talk to us a little bit about the correlation between heart health, diet, exercise, and in this case, women.
Well, women are no different than men as it relates to all of the cardiovascular risk factors. In fact, women are prevented from developing heart disease early in life due to hormones. So estrogen protects women while they're in reproductive years, in the premenopausal years, and thereby heart disease has a predilection to affect men earlier in life. But as women approach the menopause and become perimenopausal and then postmenopausal, women actually catch up with men during the 4th, 5th, 6th, and 7th decades of life, and thereby more women in the postmenopausal years die of heart disease than the next 5 to 10 most common causes of heart disease, causes of death in women. So even though we are always very concerned, for example, about breast cancer and ovarian cancer in women, in fact, in the 60s and 70s, more women die of heart disease than breast cancer and ovarian cancer. So the issue in women really is related primarily to age, in that earlier in life and before the age of 50, it's pretty unusual to see coronary artery disease in women, unless they smoke or they have type 1 diabetes. But after the age of 50, it's actually quite common to see heart disease in women. And the other thing that's unique about heart disease in women is, particularly as it relates to coronary artery disease, is that the symptoms in women are often atypical. So with men, you typical in the midst of a heart attack will have crushing, classic chest pain, sweatiness, where you know something terrible is happening. But in women, it might be something much more subtle: fatigue, abdominal discomfort, jaw pain, arm pain, and it doesn't necessarily jump out off the page the way it does in men.